Good morning, everyone. This is Ashland KY Chiropractor Dr. Gary Dillon with your weekly video health tip. Well, let's talk about what I do. Let's talk about chiropractic this morning. What does chiropractic have to do with your overall health? Many people don't think about chiropractic and their overall health. Chiropractors are health doctors, whereas medical doctors, not knocking them, we need them, are sick doctors. You usually have to be sick, already have a disease, already have a problem to go to the medical doctor. And many things that they call wellness care is not actually wellness care. Now, don't get me wrong. I highly believe that you should go get your blood work checked and get checkups by your medical doctor. However, that has nothing to do with wellness. That has to do with early detection. So if you have a cancer, God forbid, or some other disease, they can detect it earlier than they would have if you hadn't been going and getting checked up. Like I said, not wellness, early detection. Well, chiropractic has become known over the years as the, quote, back doctors, which we do a great job with the back, don't get me wrong, but many people come in here for back problems, sciatica pain, bulging and herniated discs, neck pain, headaches, numbness and tingling down the arms into the hands, and we do a pretty good job with most of that. But that's not how it started out. Chiropractors work with the spine just like a cardiologist does with the heart or your dentist does with your teeth. Your spine literally only has two functions. Number one, it holds you upright. That's your posture. The number two thing it does, pretty important, it protects your spinal cord. Now, you know as well as I do, your brain runs the show for your body. It correlates all of the other systems. And your spinal cord is just an extension of the brain. It's the communication superhighway, if you will. Now, your brain, for lack of a 4-hour explanation, produces an electrical current and shoots it down the spinal cord. Little nerves branch off the spinal cord, come out through holes in the spine, and literally not only do they go down your arms and down your legs, but they go to every vital organ, cell, and tissue that you have. The nerve that runs from your spine to your heart and lungs, if we were to cut it with scissors, you would drop dead immediately because you were cut off from the electrical source, from the power supply, as it were. I always tell people, if you've got a nice old brass lamp that's tarnished and the bulbs burn out and it's tore up a little bit, you can polish it and fix the brass. You can put a new bulb in it. You might even rewire the inside of it, but it's still not going to work unless you plug it into the wall socket. That's what your brain is, the wall socket. All right. Now, electricity travels down that spine and goes to all of those vital organs. Now, usually, if ever, you're not going to have that nerve going to your heart cut by scissors, but you might have some spinal pressure on it somewhere. This is called a subluxation. A subluxation is a shift of those spinal bones that causes a neurological problems. Now, two things can happen with subluxations. The first one is the nerve can either be stretched, it can be chafed and irritated, or it can be pinched. We've all heard about the pinched nerve before. Now, the symptoms of those three things are all very similar, and honestly, a pinched nerve, even though that's the one you hear about most often because most doctors use it as slang, a pinched nerve happens less frequently than the other two. But the symptomatology is the same. Numbness, tingling, loss of problems down the arm. But remember, these nerves also go to internal organs and you can't feel stuff that's going on there. So you could be having a problem going to your heart and not even know it. There's a thing called sudden heart failure. Now, that doesn't mean there's anything wrong with your heart. That just means something caused the heart to quit all of a sudden. Kind of getting the electricity turned off can do that. When is it okay to only be getting 80% of the electricity to your heart or to your lungs or to some other vital organ? It's never okay. That's what chiropractic was designed to do. Contrary to popular belief, chiropractic does not, quote, boost your immune system. If you have a healthy immune system, it's healthy. Chiropractic just removes the interference so your nervous system can be healthy, therefore giving you normal human immunity. If your immune system is working fine, you usually don't catch things like colds, flus, at least not very often anyway. It takes a lot of being in close proximity with those things to catch it if you have a healthy immune system. But having your spine aligned, getting rid of vertebral subluxation is essential to overall health. Not sickness, health. So hopefully you can see how a healthy spine is essential to your overall health. Things like forward head syndrome. We've all seen it. You've all seen the people that walk around like this. Stretches the spinal cord anywhere from 5 to 7 centimeters and literally causes disease. And that was research done by neurosurgeons, not chiropractors. So hopefully this has shed some light on how important your chiropractic visits are and just how bad a subluxation can be. It's not just about back pain and headaches and neck pain. It's about maintaining your health. Well, I hope this has been helpful. I've attached an article to this to talk to you about chiropractic immunity and tell you exactly how that does work. Please read the article. If you're over on Facebook, hit the like button for me. If you're over at my YouTube channel, please subscribe. Or if you're over at www.dillonchiropractic.com, wait for the prompt, enter your name and email address. That way I can send you these weekly health tips once a week. You'll never ever get spammed, and there's always an unsubscribe link at the bottom of the page in case you don't find these helpful. One of the main reasons you should get this, and also my app, we have an app in Apple and in the Google Play Station, the Dillon Chiropractic VIP app, is access to my doctor's resource page. It's one of the biggest databases on the planet. You can look up herbal drug interactions, drug-drug interactions, food-drug interactions, certain health issues. It tells you about them. Huge database. I highly advise you look at it to get your general health information and any interactions with drugs, foods, drugs, and herbal remedies, etc. That way you know if it's safe to be taking these things together. If you have any questions about this, feel free to give me a call, 606-929-9667. I or my staff, either one, will be more than happy to answer any questions you may have about this or any other health issues you may have. So I look forward to next week when I can bring you another video health tip to help you and your family be as healthy as you can be. Once again, I'm Dr. Gary Dillon, Ashland, Kentucky chiropractor. Have a great week.